Hi, my name is Angela Erskine. I'm a nurse practitioner student, and I'm going to be performing the eye, ears, nose, and throat exam on my patient Emily. First, we began by testing her vision, specifically the visual acuity, which is cranial nerve 2. We use the Snellen chart, which assesses for distance vision, and she was 20/20 in both eyes. Next, I'm going to assess for her near vision, and that's with the Rosenbaum test. So what I'm going to have you do 14 inches from your face. I want you to cover your right eye. Now read the lowest line of numbers that you can.
42836.
Okay, and now cover the other eye and do the same.
42386.
Okay, great. So that's equal on both eyes. All right, peripheral vision, which is done by assessing the visual fields through the confrontation test. So I'm going to just sit in front of you, and what I'm going to do, I'm going to have you kind of look directly at me. Get close here. I'm going to show you my finger. I'm going to hold my hand out here, and you're going to tell me when you see my hand in your gaze. All right, so first we're going to cover the same eye here.
Now.
Okay.
Now. Now.
All right.
Now. Now. Now.
Okay, great. So everything was equal there, and it was we saw my finger at the same point in time. All right, next thing I'm going to do is inspect and palpate your eyebrows and then your orbital area. So I'm going to look at your eyebrows. They are good in color, texture, size, and the end of your eyebrows extends to the temporal canthus, which is a normal finding. Then I'm going to palpate the orbital, make sure there's no swelling. My hands are really cold, so I'm just going to touch lightly. There's no redness, swelling, or any lesions present. All right, so I'm going to do the same thing basically with your eyelids, but first I'm going to have you just open and close your eyes, and that just shows me that your eyelids are working correctly. All right, go ahead and close them. And your eyelashes are all intact. There's no lesions present. I don't see any ptosis, tremors, twitching, flakiness, redness, or swelling. And then, of course, no lesions when I palpated. So next, I'm going to look at your conjunctiva and the sclera. So I'm just going to have you look up. I'm going to pull down on your eyelids. Everything is white, clear. I don't see any discharge or foreign bodies. Then I'm going to look at your external eye. And with my light here, so I'm just going to look at your corneal clarity. You can just look over my shoulder straight ahead. That cornea is nice and clear. It's white. Same with this one. Now I'm going to the sensitivity of the cornea, which is cranial nerve number 5. Basically, I'm just going to kind of touch your eye, and then I'm going to see when you blink. Okay. Okay, and that nerve is intact. And when I'm looking at your eye, I don't see any arcus or anything covering your pupil and iris area. All right, so next thing I'm going to actually assess the reflexes of your pupils by shining the light in your eye. I'll do one at a time here. And that one's positive. So is this one. They're both equal, about 3 millimeters. They're responsive to light, and they're round. And then I'm going to kind of bring this in. And there's no nystagmus. There's also good accommodation, meaning your pupils constrict. Actually, I'm sorry, let me redo that. I'm going to have you look at this photo on the wall, and then I'm going to bring the pen in close. Okay, so just continue to stare off at the wall. Okay, yes, and they're equal. They both constricted at the same time. Okay, so next thing we're going to do is test your extraocular muscles, which assesses cranial nerves 3, 4, and 6. And that way, I'm going to stand here or sit here in front of you. So we'll do the cardinal fields of gaze. That's just going to kind of make sure that your eye muscles can look in all directions. So just kind of follow my finger. Okay. So those cranial nerves are intact. Next, I'm going to do the cover and uncover test. So I'm going to have you cover your right eye with your hand and uncover your eye. Okay, so I see a normal pupillary reaction in your left eye when you did that. Now go ahead and do the same thing on this side. That's the same. And I don't see any nystagmus or like twitching when that happens. Okay, so now I'm going to look at the internal structures of your eye using the ophthalmoscope. I'll turn this guy on, if I can remember how to do it. All right, so I'm going to look at this eye. Sorry, my hands are cold. Okay, and I can see your retina. Your lenses are clear bilaterally. There's a positive red reflex on both eyes, which is good. The retina is pinkish red. There's no lesions present. I can perfectly visualize those blood vessels in there that branch from the optic disc. The disc margins are well defined. The disc is yellow. Also, the macula is 2 disc diameters temporal to the optic disc, which is a normal finding. All right, so next we're going to look at your ears. And like we've done with everything else, we're going to inspect, look at them first. You know if there's any tenderness.
Yeah.
Everything looks symmetric, no nodules, deformities. The positioning is proper. And then I'll look inside your ears. So I'm just going to put my little scope in here. I don't see any cerumen or earwax blocking your auditory canal. Your tympanic membrane is pearly gray. I don't see any perforation or discharge in there, which is all a normal finding. And I did also look at her other ear, and it's the same. So now we will assess your hearing, which is cranial nerve 8. You've been hearing me okay during this exam and responding to all the questions, but we're just going to do a little bit further testing to make sure there's any other hearing issues. All right, so first thing, we will do the Weber test. I'm going to use this tuning fork. I'm going to place it on top of your head, and then you're going to hear like a vibration, and I want you to tell me if you can hear it equally in both ears. All right?
Yep.
Okay, good. And then the next thing is the Rene test. I'm going to get the vibration going, and I'm going to place it on the mastoid bone behind your ear.
Mm-hmm.
You're going to tell me when you no longer hear the sound. And then I'm going to hold it in front of your ear to assess for air conduction. You're going to tell me when you hear the sound just by saying now, and then you'll say no longer when it goes away. All right?
Now.
You hear it?
Yes.
Tell me when it stops.
Now.
Okay, good. And I also did the other ear, and it was normal as well. So that is a normal finding to have it longer in the air conduction test, so everything looks good there. Lastly, we will do the whisper test, and I just want you to repeat back the letters or numbers that I say in each ear.
4, B, C.
Okay, perfect.
W, 8, R.
Great. Your hearing looks wonderful. Okay, so next we're going to look and inspect your nose. Everything looks good to me from the outside. It's very symmetric. I'm going to kind of palpate it for tenderness. Tell me if you have any tenderness there.
Yep.
I don't feel any nodules or deformities. And then I'll look on the inside. Back with the little scope. All right, looking inside your nares, everything is pink, moist, which is normal. I don't see any discharge, no perforations of the septum. Everything looks good there. So then I will palpate your sinuses and let me know if you have any tenderness. Okay, great. All right, lastly, we're going to take a look at your lips and then the inside of your mouth. So just looking at the outside of your mouth, everything looks pink, normal. I don't see any lesions or sores, any deformities. So then I'll look on the inside of your mouth. And since I don't have gloves, I'm just going to use my tongue blade. Normally I would have gloves and I would actually look inside of her mouth. So you can open up for me. I'm going to inspect your teeth. I don't see any broken or missing teeth, no dental caries or malocclusions, and your gums look nice and pink, no sores or lesions. I'm going to go ahead and test your cranial nerve 9. So could you please or 6, I'm sorry. Could you please stick out your tongue for me? And everything looks straight there, and then smile. And everything is symmetrical there. So I'm going to get you to open your mouth. I'm going to look at your uvula. All right, and it is midline. Can you raise your tongue to the top of your mouth? Okay. Palate looks good under the tongue. And I'm going to get you to stick your tongue out and kind of tilt it over to the side here. All right, and the other side. Okay. And I'm going to get you to open your mouth and say ah. All right, your tonsils are 1+ and equal. I don't see any pustules or white patches or anything like that. And then lastly, I'm going to have you, I'm going to elicit the gag reflex, which is cranial nerves number 9 and 10.
Okay.
All right. No. All right, and that is normal.
Okay.
So everything looks great. Thank you for participating, and that concludes our exam.